Hi, my name is Eliana Perrin. I'm a pediatrician and a brand new Bloomberg Distinguished Professor in Primary Care in the Schools of Medicine and Nursing, and welcome to Open Doors. Yeah, so in this new role, I'm really excited to return to what's always driven me, which is improving the lives of families, particularly those that come from communities that are systematically disadvantaged. And I'm someone who's always chosen to do my work in academic settings. I really love teaching and mentoring, as well as more upstream work and research. And I'm particularly interested in research that has implications for how we practice medicine or how we shape policy. Several of my colleagues around the country and I developed Greenlight, where we work to teach parents about how to prevent obesity starting as newborns. And that's really novel since most people think about treating obesity much later on or preventing it later in childhood. But what we've heard from parents when we've talked with them is that they wish they'd heard from doctors how to keep their kids healthy from the get-go. For example, we had one parent say to us, I wish we'd never started the juice habit. No doctor ever told me not to give him juice, and now he's hooked, but it would have been easier not to start in the first place. And we have a really great opportunity at that age because we see infants and toddlers so frequently for well baby checks as newborns, and then again at 1 month and 2 months and 4 months and 6 months and 9 months and 15 months and 18 months and 2 years. And we decided we would leverage that opportunity of partnership between the pediatrician and parent by answering some of parents' questions about feeding and activity and give advice about some things they may not know. So let me show you a few things. So here, for example, is one of the booklets, and you can see that there's fun pictures and graphics throughout. Things that we're encouraging parents to do are in green, and things that we're discouraging are in red. And that makes these booklets really easy for parents to follow. And we have them in English and Spanish. This is an example of the 1 month book, but this is a booklet from 12 months and it's in Spanish. And I'm going to show you a page that shows that not all crying is hunger. Here's a page that explains, why is my baby crying, and that not all crying is from hunger. And here are some pages that show, how you can tell when your baby is full or hungry. And that's really helpful for parents to learn. So we also give families in our research some tangible tools that reinforce the things we're teaching them in the office. And here's a onesie that we give to babies. Here it is. You can see it on a Baltimore Oriole that was given to me as a welcome to Baltimore gift. But it says, I'm sweet enough, please no juice. We have it in Spanish as well. So I'm really excited to work with some of the best minds in the country in academic medicine, as well as multiple stakeholders outside of academic medicine on elevating primary care and bringing people together in a common mission of holistic, humanistic, first contact, and community-oriented and community-centered care. And at a place like Hopkins, it can seem so specialized. It can seem that the sophisticated research is only about specialized medicine and treatment of serious disease. But in fact, making primary care work well and preventing some of those chronic diseases will need just as much sophisticated thought. And I'm really interested in digging right in. Why did I choose Hopkins? Well, Hopkins is an institution that in many ways is synonymous with excellence. And the Bloomberg Distinguished Professorship is such a wonderful gift to foster interdisciplinarity and bring people together around common intellectual and real world goals. Also to work and live in a city that has both the promise of Baltimore, but also the devastating poverty that really inspires me to do my best work.